Well, good morning, Internet. Welcome to the Sunday, September 4th edition of Pearls of Wisdom. As you can see, I'm sitting out here in my third office, which is my hammock chair on my deck here. It's a beautiful sunny Sunday morning, first Sunday of September. And the week of the kickoff of the 2016-2017 NFL American Football League season. Personally, I'm over the moon. I love American football. I suppose some may say I should be a bigger fan of Canadian football, but no, NFL is sort of got my heart. And one thing I enjoy even more than watching the games, I love playing fantasy football. Fantasy football, for those who aren't familiar, is one of these games. I've played it for years with a bunch of buddies from high school, and we continue to do so. You go and you choose a group of players. You sort of make your own team out of real live NFL players. And every week you pit them sort of head-to-head against one of the other players in your league. And you just hope that your players score more points than your opponents for that week. So it's all based on stats, and it's quite a bit of fun. It kind of speaks to my mathematical sensibilities and also, frankly, my love of watching football and drinking beer on a Sunday afternoon. But, you know, I think it also speaks to my interests in the clinical research field. I do a lot of work trying to predict outcomes and performance of patients following traumatic injuries, in particular traumatic neck pain. And so I spend a lot of my time trying to predict the outcome of a patient, whether they're going to recover smoothly, whether they're going to recover but more slowly, whether they're not going to recover at all. And I do this based on a series of variables, and you know, it's very similar to fantasy football. I know, for example, that I can't just base my player selections in my fantasy football league on those who run the fastest 40 time, or who did the best in the combines, or who's the tallest, or the biggest, or whatever. Frankly, the Oakland Raiders are a pretty good demonstration that you can't just go by combine scores. Slight dig there. Sorry, Oakland fans. No, but rather you have to look at not only the player, but the conditions surrounding the player. You need to look at who's throwing this person the ball, who's blocking for them, what's their blocking look like, what's the offensive scheme they're playing with, and is it a good fit for this player's skills, who's the opponent who's going to be defending them this week, what's the weather like, are they indoors, are they outdoors. You consider all of these different variables. And what I try to do as a fantasy football player, and frankly also as a clinician, is you want to look for patterns. Some people would be familiar with the concept of pattern recognition. In clinical practice, this would be not only trying to lump people into discrete boxes, which is sometimes what we try to do, and myself included, occasionally to a fault. Because it's very difficult. Humans are not discrete. It's very difficult to lump people into individual boxes. What you really want to do instead is look at patterns of the person. So you might look and say, you know, based on the person that's sitting in front of me, I see this issue, I see this issue, and both of these are causing me a little bit of concern, but you know, I see these other issues over here that actually cause me some optimism. And it's only when you consider all of these things together do you really come up with a more informed decision on whether or not, well, A, whether or not this person is likely to recover, but B, what the most appropriate interventions are for them. And I do the same thing with football. Again, it's not just going by historical averages or norms. It's not just going by the fastest, the tallest. It's looking at all the variables. It's looking at the environmental variables. It's looking at, is the person prone to injury? Are they coming off injury? There are so many different things. And again, you're looking for patterns. You may say, you know, based on my past experience, I know that those players who have returned their first week following a hamstring strain have traditionally not performed well, despite this particular person, this player, historically being one of the best at the position. So maybe this week I'm going to go with somebody else. And it's exactly the same thing I think we need to do with our patients. There's some value in trying to create discrete subcategories, and I will continue to work on that. But even those subcategories are meant to be considered within an overall broader picture of the patient's pattern of presentation, the pattern of their symptoms, their past history, their social and environmental influences on their health and on their recovery. And only then can we start to really even attempt to predict where the person is going to go. But then my final point here is sometimes no matter how good our algorithms, no matter how good we think I've studied a player or I've conducted a sound assessment on a patient, I'm still going to be wrong. We're never going to be perfect. And so at best, we're coming up with really probabilities. And you can watch one of my previous videos on for a bit on probabilities there. So there you go. At the end of the day, that's probably how I'm rationalizing my combination of two of my favorite things, fantasy football and clinical research, and in particular prognostic subcategories. All right, cheers.